It may sound obvious that an ocular pressure dressing should provide pressure on the area of the eyelid or periocular area that has undergone surgery. However, they are frequently not correctly applied. This patient has had cicatricial ectropin repair with a full-thickness skin graft. The pressure dressing is important to eliminate the potential space between the graft and the host bed and to tamponade any bleeding which may lift the graft away from its bed. Tincture of benzoin or tink benz or friar's balsam is painted onto the forehead and cheek skin to dry the skin and make it more adherent. This patient's lower lid will be maintained on traction while the pressure dressing is on. The silk traction suture is fixed to the forehead with steri strips. A paraffin gauze dressing is placed over the eye. It is critical to ensure that the eye is shut under the dressing and remains shut whilst you are padding the eye, as leaving a pressure dressing over an open eye can do serious damage to the cornea. A small roll of cotton wool is placed over the area where the most pressure is desired, which in this case is the lower lid skin graft. An iPad folded in half is then placed on top of this, and then 1 or 2 iPads placed on top again. One can instead use several gauze dressings that have been unfolded and soaked in saline instead. These are sometimes called fluffies. The iPads need to be held down by one person whilst another person applies the tape. Elastoplast dressing is much stickier than micropore and preferable for pressure dressings. When applying the tape, the maximal pressure needs to be over the eye and not on the forehead or cheek. Therefore, we suggest the following steps. Stick the tape to the forehead, but do not stretch it. Then place your fingers firmly on the tape on the edge of the dressing to allow you to stretch it whilst it goes over the pad. Then firmly secure the tape to the skin on the other side of the pad and complete the dressing by taping onto the cheek without stretching it again. Several pieces of tape need to be applied in the same manner. The dressing and the traction suture will be removed in 2 to 3 days in this patient.